Hi, Dr. Keaten at Mainely Veterinary Dentistry, and we wanted to talk to you today about 3 things that you should know about your pet's teeth. So one very common problem that we treat here that a lot of people aren't aware of is periodontal disease. So periodontal disease is infection and disease and inflammation around the tooth. And so a lot of people think when they bring their pet in that their pet is experiencing cavities, which we'll talk about in a minute. But the most common thing is periodontal disease, which again, infection around the tooth. And it's actually what we are trying to prevent on our own teeth by brushing them 2 or 3 times a day and getting them cleaned every 6 months. It's right at the gum line where that bacteria and plaque and biofilm like to live. And the body responds to that biofilm layer that builds up and creates inflammation and then eats away at the tissue around the tooth, the tissue and eventually the bone, and we start to lose bone. So this is a really common example of an x-ray of a pet experiencing periodontal disease. So we've got severe bone loss from the crown. So all of this bone should be all the way up to the crown of this tooth. And because of the biofilm that's built up from not brushing and cleaning the teeth, we get this bone loss. And at this point, the tooth has to be extracted because we've lost so much bone, there's not enough supporting tissue for that tooth, and we also can't get all that infection out of there without getting the tooth out. The good news is, once the tooth is out, we clean all that bone up, the body takes care of the rest, the infection is gone. But that's the most common thing we treat here. The second most common thing is endodontic disease. So instead of infection around the tooth, we're talking about infection at the root of the tooth. And so that's what commonly people refer to as an abscess, right? So periapical lucency, a lucency around the root of the tooth. And so this is an example of a tooth that we extracted where the tooth was broken. So at some point there was trauma to this tooth, we broke off the tooth and we exposed the pulp cavity, the center of the tooth. So then infection is allowed to get inside the tooth and travel down the nerve and blood vessel that live inside this pulp cavity. And eventually with time, that infection travels to the end of the tooth and blows out the back of it at the root. That's when we deal with abscesses or periapical lucencies at the root tip. And this can be really painful, as well as, a lot of infection getting into the blood supply because it's a blood vessel in there. And then I'll show you on x-ray, example of a patient with endodontic disease on imaging. This is from our CT machine. And this pet had several broken teeth. The owner knew about 2 of them, but we found a third. So this pet had a pretty significant fracture of its second premolar on the maxilla. And so we have these lesions around the tooth that actually on this view you can see, so right at that root tip, and it's communicating with the nasal cavity. So infection had traveled all the way down this canal of this tooth and blown out the back of the root and caused an opening into the nasal cavity with infection. So that tooth had to be extracted due to the extent of the infection already. However, in this dog, we also had both of its canines were broken right here into the pulp cavity. And thankfully, at this point, there was no evidence of significant infection at the root tips. So those teeth we're able to treat with root canals to save the teeth. So a couple of options with endodontic disease and broken teeth. The third problem I want to talk to you about that actually isn't as common as many people think, and a big reason why people bring their pets in is cavities, or Caries lesions is what they're also called. And we often think about that for our own teeth because we eat a lot of sugary things. And pets can get cavities too, but their teeth are shaped a little bit different than ours. Our teeth are used for crushing. So our teeth are shaped flat and they come together and they crush our food. With dogs and cats, their teeth are like scissors. And so they're very pointy and they cut their food or rip their food. So because of that, they don't have the same kind of surfaces, those flat surfaces with crevices in them, to get those cavities. But they do have a couple molars back here on the top and a couple molars on the bottom that do have some of those flatter surfaces that can get cavities. So if you feed your dog or cat a lot of, well, not really cats, this is a dog problem. If you feed a lot of bananas, ice cream, sugary foods, dogs can also get cavities, but it's just not as common. Thanks for listening to our video. If you want to learn more, you can go to our website at mainlyvetdentistry.com.